Surgeons of Reddit. How do bathroom breaks work on a 10+ hour surgery? Serious answer. If the MD needs a minute, the patient's safety is assured, no active bleeding, etc. The wound is covered with a sterile sponge soaked in 0.9% saline solution, same as bodily fluids, or isotonic, and he breaks scrub to go pee. They'll grab a sandwich on the way back from the bathroom sometimes. They scrub back in and surgery recommences. As an OR nurse, I have given docs OJ from a straw while they were scrubbed in and their blood sugar drops. I have also changed DRS masks for them when they had a head cold. Like caring for a toddler. Always we do what is best for the patient. If you gotta pee, sometimes you hold it. If you shit yourself, there's clean scrubs in the doctor's lounge. The patient always comes first, at least in my room. Not a surgeon, but work as an OR nurse. Most of the times they break scrub and go take a quick break when they know the patient is okay and no major bleeding. There have been instances where surgeons have had poop or urine get on their scrubs from being unable to hold it in. I've had to run to the locker room, get new scrubs, and change a surgeon's pants in the middle of a case while he was operating. I'm sure it was embarrassing for him, but we all got a good laugh about it because at the end of the day the OR is like one giant dysfunctional family and we are close to each other. Really, that's pretty amazing from a patient's point of view. This doctor cared enough about the work they were doing to crap themselves as a grown adult in a room full of professionals for you. That's dedication. Resident of general surgery here, so here's how it is done in my place. Mind that I only speak for my fellow general surgeons. For neurosurgeon or heart surgeon, it may be different. If the patient is stable and under no life-threatening condition, the first assistant, usually a senior resident or a more inexperienced attending, will take over for a few minutes. There are a lot of minor things to be done, for example, controlling minor bleeding spots, or removing adhesions, or just inspecting other part of the abdomen for possible metastasis. If the operation is a particularly complex one, liver transplant, there are usually 2 to 3 teams of surgeons who participate in the surgery. For example, one team will do the procurement, remove healthy liver from donor. One team will do the removal of the diseased liver and liver team will do the transplant. All teams have to discuss and plan out everything carefully before the operation, and the idle team stay in the break room to follow the operation, so not much is lost in communication. I wondered that because my 10-year-old son had a liver transplant in November and it took 12 hours because of how bad his liver was. I was curious, so I googled and found this answer. There will be assistants and an anesthesiologist and a lot of nurses. So it's not like the patient is going to be left all alone while the surgeon hits the bathroom. And sometimes surgeons work in shifts. And this is called breaking the scrub, so the surgeon is going to have to scrub again after using the bathroom. Nurse. Suction please, nods downwards. I've gone 10+ hours without scrubbing out, but usually just dehydrated, so just don't feel the need to pee. On the other hand, multiple times you can scrub out and come back. It's usually 3 or more people on a complex case that requires that much time, so no need to hold back if you can safely go and come back in a few minutes. Sometimes people think surgeons are at a 100% all the time during surgery, but there is time where it's more laid back, more routine parts, or even waiting for an exam to come back, like a frozen section or the image team or whatever. Funny how the question is directed to surgeons and there isn't a single one on Reddit apparently. All nurses and that one guy that is mad people forget about the others in an OR. They're all too busy shitting themselves in the OR. Obligatory, not a surgeon but someone whose job leads to me being in the room for a lot of scheduled, routine operations. You'd be shocked how much non-emergency surgery downtime there is. Waiting for Dr. so-and-so to come do X and so forth. Asking a resident to do some element of the procedure depending on where you are. Literal bullshitting with others in the room while waiting for some test to be run. They literally just leave and go to the bathroom. The anesthesiologist is really the one who is in charge, in many ways, particularly things us non-doctors would consider to be medical stuff, so they just get the surgery to a checkpoint and run to take a leak. TV and all does a really horrible job of conveying the culture in an operating theater. TV and movies do a horrible job portraying medicine, period. Pretty much everything outside of trauma is boring. As in, not entertaining. Movies and TV show everything as seconds counting, and even in trauma medicine, that's not always the case. But these portrayals have conditioned the public to think that way. The reality of medicine is that it takes time. And that's how you want it to be. Rushing is what leads to getting it wrong. And then, asterisk asterisk oh fuck. You're dead. Asterisk asterisk. Depends. Clever. In one Grey's Anatomy episode, one of the doctors come up with the idea to wear an adult diaper while in surgery. The others usually regulate their water intake a lot, which is probably unhealthy. That's a dangerous game. Dehydration can lead to cramps, not ideal when your knuckles deep in someone's brain. People in the medical field are not nearly as appreciated as they should be. There's often more than one person doing the surgery. During my surgery rotation in med school, the first surgery I was in was a 10-hour case. I was standing there retracting for 6 hours before the chief resident excused me and the intern to go pee and eat. In other surgeries I've been scrubbed in, there's often residents, other attending surgeons, or PA or RN first assists who all can take turns with each other as needed. If it's an elective, controlled surgery, there are often predictable spots where the case can be paused for a few minutes. Nobody asks about nurses, scrubs and radiologic techs. I once didn't leave a room for 14 hours. Anesthetist here. Surgeons can just scrub out and go to the toilet as long as they're not in the middle of a critical bit of the surgery. Anesthetists are the ones who can get into trouble, because someone needs to be monitoring the patients throughout. Leaving the patient would be like both pilots leaving the flight deck for a few minutes during cruise. Everything would probably be fine, but it's not worth betting the plane on it. If I don't have a trainee with me and I'm desperate, I'll contact a colleague to come and take over for a few minutes so I can nip to the loo or grab a quick coffee and a sandwich. My last surgery I was in a long duration of time was about 18 hours. The patient was mangled. We worked very hard to stabilize her, then reconstruct what was left of her face. After about the 11-hour mark, I had to shit, so bad it was hindering my performance. Also, it was a dangerous time to leave the patient without an able body to step in. So my head nurse brought in a 5-gallon bucket. I don't want to sicken you with the mechanics of the bucket work, but my nurse had to wipe me. We saved the patient, and preserved about 25% of her original face. Amazing feat, seeing as the shotgun knocked off at least 50% of it. That's crazy that she survived a shotgun to the face. Not a surgeon, but I am a doctor. I have a better work-life balance now, but when I used to work 14+ hour shifts I would not stop once to go to the toilet. I also didn't drink anything to save time. Doesn't that mean you were always dehydrated and not on your A game? I am a gynecologic surgeon. Rarely are cases that long, but it happens. There are typically multiple surgeons in the room, so you can step out if needed. Also, surgeon bladder is real. The amount of urine that you get used to holding is a lot. I've only had to step out once, and that's because I was 39 weeks pregnant and had a baby's head smoosh in my bladder. The reveal. She is both the surgeon and the patient. Never in 20 years of working in the OR have I seen a surgeon shit himself. I have heard plenty of them say, "I'm going to scrub out for a minute." Surgeries taking 10 hours or more are usually complicated enough that they involve more than one surgeon. In the midst of complex surgery, I don't feel any of my bodily needs, thirst, hunger, muscle tension, urges to use the restroom. This is the case even in particularly lengthy, 12+ hour, procedures. It's only after the case that all of those bodily demands seem to hit in a rush and I run to the restroom and then head straight to the lounge to gorge on peanut butter and crackers. Long surgeries are normally long because they are many parts. They don't just have one guy doing everything. They might have a head surgeon that directs everything, but it's not like he is personally cutting for 12 hours straight. He can leave while someone is doing some stitches or something. Not a surgeon, but a friend of mine is studying medicine, and this is, at least in some places, considered in training. Even during the first years, when they just have long days with tons of lessons, some professors, who are often surgeons themselves, don't allow for breaks or to bring a bottle of water along. They justify this by saying that you can't have a toilet break or drink water when doing surgery either, so they better get used to it now. This seems very unhealthy. It's a shame that so many medical professionals have to do unhealthy things to themselves in order to work in that field. I'm a neurosurgeon. Most cases, just hold it. For those exceptionally long ones, or even a short one where nature calls can't be ignored, every case has transition points and/or spots where a brief pause can take place. If working in a team of surgeons, one just steps out. If working alone, ensure safety, and make it brief. Not a surgeon, but a former RN circulator. The key players in surgery are an RN, the surgeons, a surgical tech, anesthesia, sometimes an implant rep, and a rad tech. If one of the key players in the room needs to leave the room, for any reason, they can break at a time when the patient is relatively stable, and then scrub in again, meaning they have to red on the sterile attire. It's a process. However, most medical professionals, perioperative or otherwise, have trained their bladders to withstand long periods of time without emptying. Also long periods of time without eating or drinking. Ever do any distance sports op? You are out there for hours and hours. However, the moment you see your front door, it seems as though an evil wizard has suddenly filled your bladder and bowels to maximum. I graduated from med school in '99. Finished my general surgery residency in '04 and have been in private practice ever since. Thankfully, cases that last more than a few hours are pretty rare outside of big academic centers. In general, you just hold it, and as other comments have stated, you're usually so focused on the case that you tend not to notice your bladder. If you've really got to go, as long as there's no bleeding and the patient is stable, you can run out to pee. As a resident, especially on the transplant service, longer operations were far more common. The entire team would usually take a break during liver transplants once we had the original liver out. You'd take 5 to 10, grab a coffee and hit the can, and then back at it. In general, though, you just hold it. The longest I've personally gone was 13 hours during a liver transplant. And yes, your bladder is messed up and stretched out for a few days after. There were urban legends that neurosurgery residents used condom catheters on occasion, but I can't speak to whether that's true or not. IDK if this is true, but I heard a story where this surgeon needed to pee but he got called in a emergency surgery, so he tried to hold it, but it was making his hands shaking. However, he couldn't leave the patient, so he literally just pissed his pants standing up and finished the surgery like that. Luckily the patient survived and they had clean scrubs at the back for the surgeon. Have you ever thought how actors filming do that lol? I thought they have more than one surgeon in the room for this reason. The person has holes for a reason. Hey, I might be late for this one, but here it goes. In my field, head and neck oncologic surgery, 10-hour surgeries can happen but are mostly performed in a double-team approach. Each team is usually composed of a senior surgeon and a resident. Here in France it's called intern. The first team removes the tumor and the second team works on the reconstruction, which usually involves harvesting skin and/or bone from the forearm or the leg, so each team doesn't interfere with the other. The team that finishes its job first, usually the reconstructive side, goes eating, peeing, doing whatever while the other team finishes its part. And when they come back from their pause, the second team take their break. In cases of long surgeries that aren't performed in a dual-team approach, most of the times we don't take breaks. Those very rarely last longer than 6 or 8 hours though. On a semi-related note, if you have a runny nose and are scrubbed in, there's nothing you can do. It runs down over your lip and you either ignore it or lap up the drips, then have someone change your mask if it becomes soiled. I work in an operating theater and have been involved in some long surgical procedures. Depending on the surgery, the surgeons have made sure there is no bleeding and then put a temporary dressing on to keep the site clean and sterile. They nip off and sort themselves out and leave the patient with the anesthetist and the ODP, who monitors everything and keeps the patient stable. Then they return and resume from where they left off. Heart surgeon here. We generally go to the loo just before scrubbing and restrict water intake before surgery. Once the surgery starts, I totally forget about bathroom breaks, to be honest. If a surgery is particularly long, we may take a break after the main part is over. Sometimes we just wait to see if there is any bleeding while the anesthetist goes about giving blood, plasma and procoagulants. That is the usual time to take a bathroom break. More than hunger or bathroom break, the thing that you feel is severe thirst afterwards. I drink loads and loads of water after a case.
Thank you so much for watching and have a good day.